Good morning, and thank you for joining us. We're getting ready to do a chin augmentation. This is actually a pretty commonly performed procedure. Sometimes it's done alone, just an isolated chin. Sometimes we do it in conjunction with a rhinoplasty or another operation. Today, we're going to be doing a chin here, and we're going to be using an implant. There are several different ways to augment the chin. Sometimes we use bone. We actually advance the bone of the chin. Sometimes we use implants, and these can be made out of several different materials. Today we're going to be using a silicone implant, and the approach for this is going to be through the mouth. That's transoral, and so you'll see here in just a moment. I'll demonstrate where we're going to place that. One of the things we always do in consultation is to make sure that the person's bite is appropriate. Always ask if they've had braces because we don't want to misdiagnose a small or recessed mandible. What we want to focus when we do chin augmentation is just the chin, just this part of the mandible in the front. Oral surgery is a different thing, and if we see someone with malocclusion or a bite that needs to be addressed by an oral surgeon, we'll refer that patient. So today, this particular lady has had, young lady, this particular gal has had braces, and you can see that her bite is actually quite good. She does have a small chin, and you can see that in profile. And a couple of the ways we determine that, we look at certain anatomic features, looking at the thirds of the face and dropping a line here, which is what's called Riddell's line. Certainly a female, or the female ideal, is to have a chin that sets 1-2 millimeters behind this line. A more masculine look would be a stronger or even square chin in the front view. But we're going to do this approach here. We're going to go down through the gums right here, access the bone. There are a couple of nerves we watch out for and take great care to avoid, and then gets us access right here, and we'll place our implant. All right, we're going to start by just pulling the lip forward. And you can see this area. This is the gingival buccal sulcus right here. And we're going to inject this with local anesthesia. This is some lidocaine. And that's the area that we'll use to access the mandible. So here we're going to use cautery and just kind of go through this lower part of the lip. Okay, and now we're right down on bone right here, and we're going to use a different instrument to elevate that off the bone. Okay, so here we're going to use this instrument here to lift some of this off the bone. And that's what we'll do to create the space for the implant. So we've created the pocket for the implant, which is to say it hugs the mandible. This is the symphysis, the central part of the mandible. We go right down to the bone. And we take this instrument, go all the way back here on either side. And then we're about ready to put our implant in. This is the particular implant we're going to be using today. I chose this one for this particular patient because it does have a little bit more, more vertical height than some of the other implants. Of course, the projection is dependent on each implant and each patient's needs. These wings are sort of lateral extensions. They go back, and the purpose of these is to hug the mandible, to hold the implant in position and keep it from shifting. Also to give a nice smooth taper so that, that when patients not only move their jaw, but also when they rub their hand along their jaw, that they don't feel any step-offs. As far as the patient's concerned, they shouldn't even know or be able to tell that the implant is there after the healing process has occurred. So this is the implant. We're going to slide it into this, to the right side first. So we'll just put it in here and let it hug the space that we've created. Ashley, grab that. Good. She's going to hold it in right there. My assistant's going to hold it right there, and we're just going to push this side in until it seats comfortably and appropriately right along the edge of the mandible.
Come out.
All right, come out.
All right, and we'll just kind of work to get that seated into place. We got the implant into place. I'm happy with the seat, the way it's seated onto the mandible. Happy with the shape and the way the soft tissue redrapes over the implant. Here it's still in place. You can see the blue line marks the midline. And we're going to close her up in layers, first with the muscle and then with the mucosa, which is the lining of the mouth.